just preparing the session now for my client. Just move the bar up a couple of rungs. Okay, just set the appropriate weight. Making sure that the weight is clipped on. Okay, so the exercise is ready now for the client to perform the exercises. All hazards have been checked for, and there's nothing, no risks associated with the exercise, so the client's ready to perform it up here. Okay, so here we've got the dumbbell bench press exercise set up for the client. This will also double up as the one arm row exercise, so the weights are here ready for the client to go. Everything's clear, no hazards, no risks. Nathan, how you going? I'm Lucas.
Good mate, how you going?
Good, thank you. I'm just here to explain the session that we've got planned for you today, but first I'd just like to make sure that you don't have any physical conditions or illnesses that are going to prevent you from any type of training that we're doing today.
Yep, no worries mate.
Do you have any type of injuries that we need to be concerned about? Any upper body, lower body injuries, joint injuries?
No, I'm pretty good.
You're all in good, all in good physical health and good to go.
Yep, good to go.
Great. So the session that we've got planned today, we're going to be performing a dumbbell bench press. Okay, we're going to be performing a barbell back squat, and we're also going to be performing a one arm dumbbell row. So that will complete the weight session of our program. Then we're going to be moving on, we're going to do some cardio, so we'll be on the rowing machine, and then we're going to do a little bit of boxing on the bag. So all the equipment's set up out there ready to go for you.
Great.
So we'll move through each thing as we go, and I'll explain each exercise to you as we go along, and if you have any questions, don't be afraid to ask. But do you have any questions for me now before we get going?
No, that all sounds pretty good mate, yeah.
Alright,
looking forward to getting into it.
Good, let's get out there.
Beautiful.
Cool.
Thanks mate. Cheers.
Right, so Nathan has told me in his fitness assessment prior to exercising that he'd like to increase his muscle endurance. We have another client over here, so we're staying out of the way of her, but for a fitness test we're just going to do a push-up test. So Nathan's going to do a maximum amount of push-ups that he can do in one set, and then we'll tailor his program towards what his results are. Yeah, so just so you want to make sure that your arms are out level with your shoulders. Okay, you're going to go all the way down, keeping your back nice and straight. Okay, just drop down to the floor and come up. Going to demonstrate to Nathan here how to do the dumbbell bench press. Okay, Nathan, we're going to be working the pectorals today, so moving the shoulder and the elbow joints. So just laying back flat, engage your core here. Alright, you want to start level down with your chest, keep your elbows out. You just want to exhale as you push up. Yep. Good. 10 reps of that, and then we're going to switch exercises.
Watch in. Good. And back.
Just come back. Good. Yeah. Straight up from here. Down. Just make sure you engage your core, keep everything nice and tight. Okay. Exhale on the way up. Inhale on the way down. Good reps. Let's go 2 more reps. Keep the core tight. Good. Last one. Good. Come down. Okay, so now I'll just show you how to do the one-arm dumbbell row leg. So you want to keep one same arm and leg on the same side of the bench. Okay, push your chest out. Okay, keep this back nice and flat. All right, you're just gonna pull up to your chest like so. And lower it back down. Okay. So we'll do 10 reps of that exercise and then the rest of the next one. Okay. Alright, so what you're going to do is place one knee on the bench, okay? You're going to place the same hand a bit further forward, okay? Keep this back, maintain this straight back. Alright, keep your head up, reach forward, grab the dumbbell, okay? And you're going to pull the dumbbell up towards your chest, keeping the back straight. Alright, focus on using those ROMs at the back, traps. Okay, keep the core nice and tight. That's it. Go all the way down, get full extension. That's it. Good. Okay, nice work. Good straight back. Good technique. That's it. Good work. Okay, focus on your breathing on the way up. That's it. Okay, last rep. Okay, place your weight down. So for this exercise, the client will be performing back squats, and it'll be at a weight of 65% of their 1 rep max. So just step underneath the bar there, mate. Okay, nice and tight, engage your core, lift up. Okay, get your feet nice and wide, shoulder width apart, toes pointing out. Make sure that your knees go out over your toes. And just squat down to about parallel with the floor. Okay, there we go. Good job. And up. Good. Make sure that your back stays in line. Keep your back straight. Head up. That's it. Good. There you go. Good work. Good work, Nathan. Yeah. Okay. Great. Okay. Good work. Keep those knees out, keep that back straight, engage through the core. Okay. Target those glutes. Let's go, 2 more reps. Good. Last one. Excellent. Step forward, re-rack. Good job, mate. So for this component of the session, we've got a cardio exercise. We're going to be using the rowing machine. Okay, we've got a number of different difficulty levels on the side, different workouts on here for the client. Everything's good to go, the machine's in perfect working order. Let's go. Alright Nathan, you've got the rowing machine here. Okay, so obviously as time increases on the machine, your heart rate's going to go up, blood pressure's going to go up, oxygen demands are going to go up, and you're going to be using an anaerobic system for the 8 minutes of exercise. So feet are strapped, nice and tight. Alright, so just maintain straight back through there. Now slide the chair back and pulling the machine towards the chest. That's it. Good. Okay, so just maintain the breathing. Okay, breathing out, breathing in on the way in, out on the way out. That's it. Maintain straight back. Let's do 3 more. That'll be good. So we've got Nathan who's going to be participating in some boxing on the bag for some innovative cardio. So Nathan, just let's go. You're going to stand with your left foot slightly forward. Okay. gloves up to your face. Alright, now when you reach out and punch, you're going to turn your hand over, okay, and then bring it back into your chin. Alright, and the same with the left hand. So you're going to go in, out, in. You're just going to continuously jab at the bag. Alright, so what you want to do is when you reach out and punch, you want to make sure that this hand turns over and then it comes back. Okay, so rather than doing this, you want to turn over. Hold it there, come a little bit closer to the bag. Alright, now we want to pick up the speed a little bit and get nice quick jabs up against the bag. So just some considerations now for the special population. So we've got a client with high blood pressure. Obviously, we don't want them to go too vigorously in their activity. You don't want to overdo it. Okay, they're going to have medical clearance prior to exercise. They could be on certain medications that limit the amount of exercise that they do. You might want to start them off with something like a treadmill. So it's a brisk walk or a light jog, something that's not as rigorous as a rowing machine. The complications that you can have with high blood pressure are heart attack, stroke, heart failure, aneurysms. So you don't want to put the client in any danger of that. My client Nathan actually had a knee injury, so we want to have exercises that require a little less stability that still work the major muscle groups. So he may have a problem doing the back squats for his knee, so therefore we will probably stick to machine weights, so leg press, little less stability, leg extensions, hamstring curls, and then maybe some standing glute exercises. There's also glute exercises that you can do with resistance bands laying on the ground, something that can target and fire the glutes in that way, that require the knee joint, take a little more pressure off the knee joint. With the client with a lower back pain, same thing applies with the squat. You know, you want to take them out of that position where they're going to be engaging their core and using a lot of their lower back for bracing in the eccentric phase. So leg press machine is also an option. If the leg press machine is a little hard for them to get down into, okay, you can also use the leg extension machine. You can use glute exercises, so standing glute exercises with resistance bands or cables. Some hip rotation flexion machines allow you to do glute exercises to strengthen the glutes and the hip flexors. Also a lot of stretching through the glute area, hip flexors, lower back to try and free up that area. As well as a lot of core work, so stabilizing the core can help with lower back pain, help strengthen the lower back. So as you progress forward with those type of strengthening exercises, you might start with body weight such as bridges, core work, and then gradually do some activation of the glutes. Once the lower back pain starts to subside a little bit, you can then progress forward to different exercises, building your way up to squats eventually. Okay, so just have a seat here. Okay, so we're just going to perform a hamstring stretch here for Nathan. So just one leg comes in here. Alright, so you want to keep this knee locked out, okay? This foot tucked in against the inner thigh. Alright, reaching out with this hand forward, keeping that knee bent. Alright, keeping the back straight, head up. Do you feel the stretch?
Yep.
In your hamstring there?
Yeah.
Is there any pain or anything associated with the stretch?
No, it feels good.
Okay, so we're just going to hold that stretch for about 10-15 more seconds. Okay, so you want to continue to breathe throughout the stretch, breathing normally. Alright, now we're going to switch legs. So exactly the same stretch on the other side, keeping the back straight. Maintain regular breathing. Okay, good. Do you feel the stretch in the hamstring on this side?
Yeah, I do.
Alright. Okay, so we're going to be using the doorway to perform a pectoral stretch today. The facilities out in the gym are being used, so just for a bit of privacy for the client, we're going to come in here and stretch the pecs after his dumbbell chest press. So Nathan, just with your arm up against the doorway and your elbow at 45 degrees. Okay, just want to keep that, and then you're just going to rotate in. Okay. Do you feel a stretch coming through your pec there?
Yeah, I do, yeah.
Okay. Any problems with the stretch? Any pain or?
Nah, it feels good.
Okay.
Yep.
Good. So just hold that stretch for 10 seconds. Okay, just continue regular breathing. Good. Right, now we're going to switch sides. So you can place your arm up against this side or this side, whichever is more comfortable. All right, keeping the arm at 90 degrees. Okay, you're just going to turn your trunk again. Feel the stretch coming through your pec.
Yep.
Okay. Any pain?
No, it feels good.
Good.
Actually, it does.
All right. Good job.
Beautiful.
Feel
Thanks,
good?
mate. Yeah, it feels really good.
Good
Cheers.
stuff.